Hola.
Hi, I'm Dr. Angela with Hearing Healthcare Center.
And I am Alex Nantz, also with Hearing Healthcare Center. I have a statement that I would like for you to correct if it needs to be corrected.
I love to correct things.
What is the most common joke we hear in the office?
That's not a statement.
Yes, it is.
That's a question.
What is the most common joke that we hear in the office?
Well, your punctuation was a little off there, buddy.
Would that statement be correct?
That would be correct.
I am a new client. I'm looking for a place to get hearing aids. I've heard a lot of good things about you. I've got a friend who comes to get hearing aids there. I found you online. What can I expect from my first appointment here at Hearing Healthcare Center?
I am going to answer that question a little more broadly.
Okay.
Because our viewers are not all coming here.
Mm-hmm.
So I'm going to tell you what you should expect at your first visit to an audiologist's office, which consequently is what you will also find here. The first thing you should expect is that you are going to do a lot of talking, because I'm going to ask you a few questions. What are your biggest difficulties with hearing and communication? Where do you have the most trouble with your hearing? And then I'm going to stop talking and I'm going to listen, because you have a very individual, personalized listening experience. And if I just slap any old hearing aid on it because that's the one I'm familiar with, I may very well not be giving you the care you need.
So we don't do just one particular hearing aid here. We do a few.
Correct.
Okay. All right.
Correct. So what are some things that do give you difficulty when you're trying to listen to a situation?
Well, let's say, obviously not me, but things that we've heard in the office. Let's say going out to eat, like Cracker Barrel or places like that. I have a hard time hearing there. Watching the news, I have a hard time with female voices on listening to the news. I can't hear my granddaughter's voice.
We also have issues about a particular person's voice. We have issues about listening in the car. We've got issues about listening on the telephone. We get issues about a particular example. Here's a story.
Story time.
Story time. Yay! Had a fellow come in and he really didn't fit the typical picture of somebody who needed top-end technology. And of course I'm not going to fit somebody with top-end technology if they're not going to be able to utilize all of those features. According to our log it all, the little insights in the hearing aid that tell us how many hours you've spent in certain listening environments, that top-end technology was only being accessed for 2 hours out of the whole week. 2 hours. And so I shared that with him, and he looked at me and he said, but those 2 hours, that's when I was at McDonald's with my buddies. I want to hear them. So if I hadn't listened to him tell me that story, I would have probably thought he was a better candidate for a lower level of technology. So I have to listen to the stories so I know exactly what the person sitting in that chair needs. So after the stories, then we do the hearing test, right?
Last time I had a hearing test was probably when I was in school, and they did a little beep beep thing. Is that all this is?
No. What you should expect on your first visit is the interview that we just did, the stories, then visual inspection. You should look in the ears.
My eyes work fine, I can see.
I should look in your ears. And in our office we have videotoscopes so that the client can also see what's in his or her ears. And make sure that there's no foreign bodies, no holes in the eardrum, no fluid, no wax. Make sure we can do an appropriate hearing test. What?
Nothing. I'm still laughing at visual inspection.
Diagnostic hearing test. We are looking for pure tones. Absolutely. We're also looking for speech understanding and speech understanding in noise. At the bare bones minimum, You should have air conduction, bone conduction, speech recognition, and speech recognition and noise. That's bare bones. If I see anything else in the way, then we'll deal with that as well.
After the hearing test, what should you expect? Let me say that again without spitting all over myself. What should you expect? Yes, get your tissues from your audiologist after your hearing test.
You should expect an explanation of the results. I don't know how many times people have told me, well, I never knew that. You should have the audiogram in the audiogram. We'll try that again.
We've had clients who've gone and received a hearing test and haven't had their results explained to them.
Absolutely. They were simply told this is what you need. Or they weren't explained.
Haven't had it explained in a way that they could understand.
Correct.
Okay.
You should expect to carry a copy of your audiogram home with you when you leave that day.
And I knew there were some that don't do that.
Mm-hmm. And you should expect your audiologist to ask you, do you have any questions about what we've just gone over? And then stop talking and wait for questions. Now, the coolest thing that we do here, I think, is if the client is a candidate for amplification, we do a week-long in-home trial with hearing aids.
There will be places that will put these hearing aids on, try them, see how they work for you. Oh, these work great. And here, great. You want to buy them. And that's it. You're not allowed to take them home where your life is. Whereas here, it's take them home. Listen to these environments, the stories that you were referencing earlier. Try them and see how they work for you. And then they come back. Something else that not a lot of people expect or gets addressed that I'm aware of, but should be addressed, that it's not a one-time shot. Programming finished. It's a progressive.
Wasn't
thing.
sure where he was going with that.
Because most people think, I get the hearing aids, my problem's fixed.
Oh, yeah. No, that's not true. Okay, so here's another story. A lot of times people are told by their family members, you know, you really ought to have your hearing tested. And that goes on for like 7, 8, 9, 10 years before they come in and sit in this chair to talk to me. Why would they do that? They know they're having problems. So if it takes them 10 years from, yes, you're having problems, to, yes, I admit I have a problem, how long before that you're having problems conversation with the family member did you actually start having problems? So let's say you've got 20 years worth of losing your hearing. So over those 20 years, you've become accustomed to a new normal, if you will, and it's not normal. So learning how to hear again is going to take at least a week, bare minimum. More likely it's going to take a couple of months until you've assimilated to a new normal.
What they can expect from this office is they go through the whole week, they try the hearing aids, there will be some situations that aren't quite up to snuff of what they need. They come in, they tell you, and then you can make adjustments as needed because it's going to take a little while to at least get it to where it should be. It's not a, here's a car, go.
Right. So I know we're only talking about the first visit, but when you come back after that week in-home demo, if you like the hearing aids, then we'll order a pair for you. You will keep the demos for that next week while we're waiting for your hearing aids to come in. So by the time you get your hearing aids, you've already been wearing hearing aids for 2 weeks. We've made some adjustments at that first follow-up, and then we'll make some adjustments at the fitting. 2 weeks later, you'll come back so that I can make sure all of the adjustments we've made thus far are doing what they're supposed to be doing. And then, if everything is good, we'll release you for 6 months. This is not a one-and-done kick to the curb. I like to see my folks twice a year, do a hearing test every year, reprogram the hearing aids to match.
But that is something that they should expect at their first appointment here. They should come in knowing this is not going to be a one-shot done. This is going to be a time span to improve your hearing.
Yeah, this is continuing care.
Okay. Something else is, should someone come with at that first appointment?
Oh, absolutely. The problems that our hearing impaired people are dealing with are communication problems. And you really don't sit and talk to yourself. Well, you might sit and talk to yourself a lot. But normally speaking, people don't sit and talk
Did
to
you say I'm
them.
not normal?
I said no such thing. But I did not say it either. So yes, hearing loss does not happen in a vacuum. Bring someone along for a couple of different reasons.
Yeah.
First reason, the person with the hearing loss may not hear everything that's said in the discussion.
Mm-hmm. It's a lot of information to retain too.
Yeah. So a second pair of a second pair
Of ears, hearing aids and ears put together.
is always a good idea. The second reason to bring someone along, if I ask the hearing impaired person, do you have any issues hearing from another room? The hearing impaired person may say, no. The significant other that's with the hearing impaired person may say, he doesn't hear me at all.
Mm-hmm.
And that's not calling the hearing impaired person, someone who's not telling us the truth.
No.
But if they can't hear it, they don't know.
Yeah.
You don't know what you can't hear.
And also, the person that you live with is the person who you communicate the most with.
Correct.
And you need to get used to their voice.
Correct.
So when you're wearing the hearing aids for the first time and then you're able to get that communication back, it's a big deal. So you should bring somebody, not just for the information, but also so your brain can start to retrain to hear that person's voice starting in here.
Correct. If they can hear my voice, everybody can hear my voice. Because I'm loud.
You've trained yourself.
I've trained
to be able to
myself to
speak.
be heard.
Yes.
But yeah, you're absolutely right. Alex is 100% correct there.
Ooh, I get a cookie.
The most important thing, the very most important thing is when you go into an office for the first time, you have to be comfortable there. You have to be heard, you have to be listened to, and you really need to be able to develop a relationship with your audiologist, because if you can't develop that relationship, then your audiologist isn't listening enough.
Mm-hmm.
So, see you next time on
Cues
and Tips. Bye.